My name is Wong. I'm an occupational therapist and certified hand therapist, and at my clinic here, Hands On Therapy Services in Miami, Florida, I deal with a lot with ulnar-sided wrist pain after surgery because we do. We have, as a certified hand therapist, I tend to see a lot of people after surgery, right? So a lot of my videos are to help you think about what you can do to avoid the surgery if you have a chance. But when you cannot avoid the surgery, this is what we're talking about here, right? Ulnar-sided wrist pain, what is it and what you can do, part 2. So in part 1, we talked more about chronic types of issues when it comes to ulnar-sided wrist pain. Part 2, we're going to talk about acute, or what we call like after surgery, right? Because there are 2 different types of problems, and so in a way you're treating them a little bit differently. So now, if you have ulnar-sided wrist pain because one common one is a distal radius fracture. Now, a distal radius fracture is a fracture of the radius, right? And so if you broke it, then you either were casted and, stabilized that way, or you had surgery and stabilized that way. But what happens is this bone is broken, and this bone, the radius, right, in order to not have ulnar-sided wrist pain, you have to be able to move this bone, rotating it on this bone. This is ulna. So what happens in an acute problem or after an injury type of problem is because you're casted, you had to stiffen up a little bit in your healing. And it didn't just stiffen you up here at the wrist where you couldn't go up and down. It stiffened you in supination, that's the S, and pronation, that's the P, right? It stiffened you in supination, pronation. And so what happens is when you cannot supinate and pronate, you will have a tendency to develop ulnar-sided wrist pain. Now, a lot of people will jump to the conclusion, oh my God, I think you tore a ligament, the TFCC. There must be something wrong. And yeah, it could, but very rarely is it torn and fractured. I mean, you have to fall in a very specific way, and it's really hard. But most of the time, there's always going to be someone who's like, oh, that's what happened to me. Yes, but it's not as common, right? Commonly, you break this bone, and you can't turn your palm up and down, and that causes ulnar-sided wrist pain. So what I usually have to do with my patients is, a lot of people are worried about that. I also teach other therapists, and a lot of those therapists are always coming to me and telling me, hey, like, should I be worried? What should I be looking for? And you don't have to be worried about it. You can keep an eye on it, but just know that this is what I usually tell my patients, if we can help you get supination and pronation smoothly, we can recover all your motion, and we get it, like the quality of your movement back, you're going to be able to get rid of your ulnar-sided wrist pain. So the biggest thing is you want to get supination and pronation. And when you improve that will help to get rid of ulnar-sided wrist pain. So how can we do some of that? Well, if you've had surgery, I really would encourage you to go to a therapist. I actually was talking to another therapist who fell and broke her arm because, we're humans, right? We fall and we break things too. But, going to a therapist, they can actually manually move you and stretch you. So if from a chronic standpoint, I'm like, don't stretch. When you break something, you really get very stiff, and this is a really great time to stretch. So if you want to stretch, let me see if I can show you a way that you can do it yourself. Supination and pronation, right? I don't have a towel, but normally I tell people, right, this is my yoga block. Normally I tell people, put a towel here underneath your arm, because when you turn your palm up and down, and when you cannot turn it, your shoulder helps you. So when you turn your palm up, look, your elbow's going to try to dig in, and then when you're turning your palm down, your elbow's going to wing out. Don't let that happen. What I always find is people who cannot supinate and pronate always end up with a shoulder problem. So when I work with my patients, it's something we look at and something we keep an eye out on. But if possible, you're going to get a towel, roll up a towel. It doesn't have to be this thick. I don't actually like it this thick. That's going to stabilize your shoulder, and you're going to work on turning your palm up, and then work on turning your palm down. That's just active movement, right? So this is considered active movement. If you want to stretch it, all you have to do is you have to grab it and roll it, right? Grab it and roll it. So grab it and roll it, grab it and roll it. And remember, it's this bone is this long from the elbow down. So don't just think about grabbing it here. A lot of times if you work up here, all your muscles for your wrist actually start up in your elbow. And so if you do some things at the elbow level, it's gonna release some tension at your wrist level, all right? So you have active motion and then you have passive motion. Passive motion is using your other hand and rolling it and pulling it like this, right? Now in my clinic, one of my best things that I like to do is I like to move into ease versus restriction. This is also something I teach my students as well when I teach my manual therapy course. Like, you already have pain. Why are you trying to cause yourself to have more pain when you're doing your therapy? This is what makes therapy so unbearable sometimes, because it hurts and then your body is reacting to it. Here's my little tip. If it hurts coming up, then go down, right? So turn your palm down first. So spend a little bit of time. Believe it or not, if you've had surgery, you're probably missing a certain amount of pronation as well. So you can twist it, right? And then in this twisted position, you can move your wrist, up and down, right? So twist your arm so you're turned down, right? You can move your wrist with your fingers open. When your fingers are open, the muscle that opens your fingers is helping your wrist. When you make a fist, then you're isolating it down to just two wrist muscles, right? So that's pronation with wrist motion. And then the other way you can do it is, once it's less painful, then you can twist it the other way and you could do it the same. Now, I don't know if you remember in my other video, I said that there's two muscles that were on the ulnar side, right? You have an extensor carpi ulnaris, and then you have a flexor carpi ulnaris. Well, this muscle here, everyone wants to work it like this because this is what we call extension. But there's a trick to that muscle. That muscle likes to work better when the palms are up in supination. So if you can, you're gonna roll that sucker up and then you can work it in this position, right? And you could do it like that too. That's a really good release. It doesn't feel as good when you do it yourself. It feels so much better when someone else does it. Especially when you have pain, especially when you're really stuck. It's a really good idea to go to a therapist because they can sort of pin you down a little bit better. Supination and pronation is really hard to isolate by yourself. I'm doing it because I know how to do it, because I have to demonstrate this shit all the time. But when my patients come in and they cannot turn their palm up and down, the shoulder, she likes to come to play, right? She likes to come out and she likes to do this number. And so when you're trying to do this yourself, trying to get that supination and pronation, trying to get rid of that ulnar-sided wrist pain, it can be really hard to do yourself because you can't like pin everything down. So I would just encourage you, listen, if you have ulnar-sided wrist pain after surgery, really go talk to your occupational therapist, certified hand therapist, and see how they can help you get rid of your ulnar-sided wrist pain and get more motion. That's just one example because this video is already 10 minutes long, but there's a lot of ways to go about doing it, and it really just depends on the nature of your injury, the nature of your surgery, and how your body is responding. And so this is one of the reasons why I encourage, like, hey, go to someone, even if you're going somewhere so that they can teach you what to do, right? Everyone's body is a little different, so that's why I say with my patients, like, hey, if you only want to come in and let me teach you, I will teach you. I will tell you what to do, and you can try to do it on your own. Most of the time, patients, they come a couple more times, several more times, to get rid of their pain and get better motion, because like I said, if you can't turn your palm up and down, it's going to really affect your shoulder, and you don't want to risk that, right? So let me know if this helps, but ulnar-sided wrist pain is a little bit more complicated than just like stretching it or just vary one specific exercise. It just depends on like what else is going on, and I hope you get the help you need. So I hope that this video just helps you to get started, and this video helps you to have a little bit more understanding and awareness of what ulnar-sided wrist pain is, and then you could take it to your therapist and say, hey, this is what I've learned from Huang, and what do you think? And then get your shit fixed. You know what I'm saying? Life is too short to be in pain, I tell you. So if this video helped you, please like, subscribe, and please feel free to leave me a comment. But if you need me, my link's below. My clinic is here. We're located in Miami, Florida. And again, my name is Huang. Let me know if you need my help. All right, thanks.